Welcome back, health enthusiasts. Today, we're diving deep into the vital role of our kidneys. Think of them as the superheroes of our bodies, tirelessly filtering out toxins and keeping us healthy. But what happens when these guardians start to struggle? We're talking about 10 red flags your kidneys might be sending you. From subtle signs to glaring warnings, it's crucial to pay attention. Because when our kidneys falter, it's not just a minor inconvenience, it can lead to serious health complications. Did you know that over 37 million Americans battle kidney disease? Shocking, right? And what's even more alarming is that many are unaware they're affected until it's too late. Stay tuned as we uncover these warning signs and empower you to take control of your kidney health. Don't forget to hit that subscribe button and join our community committed to living our healthiest lives. Let's dive in absolutely. Here's a captivating rewrite. Ever heard the saying prevention is better than cure? Well, when it comes to kidney health, it couldn't be more spot on. Often, the earliest signs of kidney issues mimic other conditions, making them easy to overlook. But here's the catch. By the time the serious symptoms kick in, the damage may already be done. That's why, in today's video, we're all about proactive care. We're uncovering the top 10 signs that your kidneys might need a helping hand, and we're not stopping there. We'll also equip you with 9 powerful strategies to nip any potential problems in the bud. Because let's face it, when it comes to our health, knowledge truly is power. So stick around, arm yourself with the information you need to safeguard your kidneys, and let's take charge of our well-being together. Before we dive in, just a quick note, everything you'll hear in this video is unbiased, thoroughly fact-checked, and reviewed by qualified health professionals. So, without further ado, let's jump in and explore the 10 signs that your kidneys might be calling out for help. Number 1. Trouble sleeping. When your kidneys are failing, they can't filter toxins properly, causing them to build up in your bloodstream and wreak havoc on your body. This can make it difficult to sleep and get proper rest. Additionally, it can lead to sleep apnea, a disorder that causes you to stop and start breathing repeatedly during sleep. This can cause you to snore badly, and in some cases, it can even lead to obstructive sleep apnea. Sleep apnea is very common in people suffering from chronic kidney disease. If you're experiencing these issues, it's important to see a doctor to check your kidney function. Number 2. Dry and itchy skin. Our kidneys are amazing multitaskers. They not only filter toxins from our body and help create red blood cells, but they also maintain the proper balance of bone minerals. When our kidneys start to fail, they can no longer keep this balance, leading to dry and itchy skin. This might seem like a minor inconvenience, but it can be a significant sign of kidney issues. Additionally, when toxins build up in our bloodstream, they can cause various skin reactions. So, if you notice persistent dry and itchy skin, don't ignore it. It might be your body's way of signaling that your kidneys need help. Remember, catching these signs early can make a big difference. If you're finding this information helpful, be sure to like this video and subscribe to our channel for more health tips and insights. Number 3. Shortness of breath. Most people think shortness of breath is only related to heart or lung diseases. However, it can also be a sign of kidney issues that shouldn't be overlooked. When your kidneys can't filter out extra fluids and toxins, they can build up in the lungs, making it hard to breathe. Additionally, a low number of red blood cells and anemia can starve your body of oxygen. In severe cases, lying down might even make you feel like you're drowning. If this happens, it's crucial to see a doctor immediately. Number 4. Fatigue. Your kidneys play a crucial role in filtering out toxins from your body. When they're not working properly, impurities can build up in your blood, making you feel constantly tired and worn out. This can leave us feeling tired, weak, dizzy, and unable to focus. Additionally, healthy kidneys produce erythropoietin, a hormone that helps create red blood cells, which carry oxygen throughout our bodies. When we have fewer red blood cells, we feel even more tired and fragile. This is where anemia kicks in. Number 5. Feeling cold even in a warm room. If your kidneys aren't functioning well, it can lead to anemia. Anemia can make you feel chilly, even when everyone else is warm and comfortable. This is a sign of kidney disease that can easily go unnoticed or be mistaken for simple anemia. If you often get the chills in a warm room, make sure to get your kidneys checked to uncover any underlying issues. Number 6. Urination issues. Your kidneys are essential for urine production, so any changes in your urination habits can be a red flag. Frequent urination accompanied by pain or a burning sensation is a cause for concern. Likewise, if you notice a decrease in the amount of urine, it could indicate a kidney problem. If you find yourself getting up in the middle of the night to pee frequently, it could also be a symptom of kidney failure. Don't ignore this sign, see a doctor immediately to get checked out. Number 7. Bad breath and metallic taste. People with kidney disease often complain that food tastes like metal and that they have foul breath all the time. This can also lead to a reduced appetite. These symptoms are caused by a buildup of toxins in your blood, known as uremia. Bad breath can be accompanied by nausea and vomiting, making even the thought of food unbearable. If you notice a persistent metallic taste or bad breath, it could be a sign that your kidneys need attention. Make sure to consult a healthcare professional for proper diagnosis and treatment. Number 8. Swollen ankles, feet, or hands. When your kidneys aren't working properly, excess fluid can build up in your body, leading to swelling in your legs, ankles, feet, or hands. Additionally, failing kidneys cause a buildup of sodium, which contributes to this swelling. However, it's important to note that swelling in these areas can also be a sign of liver, heart, or chronic vein diseases. This is why swollen extremities are often overlooked or attributed to other conditions. Don't ignore these signs. Your body might be trying to tell you something about your kidney health. Number 9. Foamy or bloody urine. Blood in your urine, also known as hematuria, can be a sign of kidney infections, tumors, kidney stones, or kidney failure. When your kidneys aren't functioning properly, blood can enter the urine, causing it to turn brown, red, or even purple. Women might mistakenly associate this with a late period, but it's important to recognize that it's not normal. Foamy urine is another red flag. Discolored urine with bubbles or white foam can indicate a high amount of protein in the urine. This foam resembles the kind you see when making scrambled eggs because it contains albumin, the same protein found in eggs. Number 10. Feeling puffy around your eyes. If your kidneys are damaged, they may allow protein to leak into your urine, leading to puffiness around your eyes and face. So, it's not just your feet, ankles, or hands that might swell, your face can be affected too. While these symptoms can indicate other disorders, it's crucial to see a doctor to determine the exact cause. Ignoring these signs can delay necessary treatment for kidney issues or other underlying health problems. We've covered all the major signs of kidney disease. Let's dive into 9 ways to prevent kidney disease and keep your kidneys healthy. Here's how you can take proactive steps to maintain optimal kidney health. Number 1. Stay active and fit. Regular exercise is essential for a healthy life. It benefits your heart, brain, lungs, and kidneys. Keeping active helps maintain optimal blood pressure, which is crucial for healthy kidneys. Whether you swim, walk, or engage in any physical activity daily, you'll reap long-term benefits. There are no excuses for not staying active. You have time to exercise, and countless activities can easily fit into your busy schedule. Do it for your kidneys, your happiness, and your overall health. Number 2, be careful with medication. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen can damage your kidneys if overused. Additionally, long-term use of proton pump inhibitors, PPIs, can increase your risk of kidney disease. It's important to take medication in moderation and only when absolutely necessary. Always consult with your healthcare provider to ensure you're using medications safely. Number 3, take antibiotics only when you need to. Antibiotics are powerful medications that can effectively eliminate bacteria from your body. However, they can also have serious effects on your kidneys. These drugs contain toxins that force your kidneys into overdrive to cleanse these substances from your system. If your kidneys are healthy, antibiotics typically won't cause much harm. However, if you have existing kidney issues, it's crucial to discuss with your doctor before taking antibiotics like penicillin or sulfonamides. Always use antibiotics responsibly to protect your kidney health. Number 4, proper hydration. As you might have guessed, the first step to preventing kidney disease is proper hydration. Drinking between 4 and 6 glasses of water a day helps your kidneys function properly. However, don't overdo it. Studies have confirmed that overhydration has no real benefit for your kidneys. Stick to a balanced amount to keep them in top shape. Number 5, eat healthy foods. Studies have shown that kidney problems are often linked to other medical conditions like high blood pressure, diabetes, and cardiovascular diseases. These conditions are typically the result of poor diet and lack of exercise over time. To prevent kidney disease, follow a healthy nutrition plan. Eating well doesn't have to be boring, it can be delicious and incredibly beneficial for your body. Remember, food is the best medicine. By making healthy choices, you're taking a major step toward protecting your kidneys and overall health. Number 6, keep your blood sugar in check. People with high blood sugar levels or diabetes are at higher risk for developing kidney problems. Excess sugar in the blood can damage the nephrons and blood vessels in the kidneys, impairing their function. Those with diabetes need to be particularly vigilant about their kidney health. Regular checkups with your doctor can help spot any early damage and prevent further complications. Managing your blood sugar levels is key to protecting your kidneys and overall health. Number 7, avoid using too many supplements. Just as medications can strain your kidneys, so can excessive use of vitamins, herbal extracts, protein bars, shakes, and other supplements. Your kidneys have to work harder to filter out the waste from these compounds, potentially causing harm. Don't overdo it with supplements, always consult your doctor first. They can review the ingredients and advise if there are any risks for your kidneys. As a general rule, it's best to avoid taking too many supplements to protect your kidney health. Number 8, test your kidney function regularly if you're at risk. If you're over 60, born with a low birth weight, or have a family history of cardiovascular disease, it's crucial to test your kidney function regularly. Regular screenings can help detect any issues early and prevent further complications. This is also important for people with high blood pressure or a family history of kidney problems. By staying proactive with regular testing, you can catch potential problems early and take steps to protect your kidney health. Number 9, avoid smoking and drinking too much. It's no secret that smoking and heavy drinking can have serious long-term effects on your body. To protect your kidneys, try to quit smoking and limit your alcohol intake. Heavy drinking and smoking can raise your blood pressure levels, which in turn damages your kidneys over time. High blood pressure constricts the narrow blood vessels in your kidneys, eventually weakening them. By avoiding these habits, you can help maintain healthy blood pressure and protect your kidneys from long-term harm. People dealing with obesity should also get regular kidney screenings. It's always better to prevent than to treat. So, take care of your body, maintain an active lifestyle, and keep your kidneys in good condition. They're crucial for your overall health. Keep an eye out for any of the 10 signs that your kidneys might need help, as we've discussed above. If you found this information useful, don't forget to like this video and subscribe to our channel for more health tips and updates. Thanks for watching. Your wellness is our mission. Stay healthy and take care.